Hello, this is Dr. Nyla Goldenberg from Functional Endocrinology. Today we are going to talk about gastrointestinal health as root cause of chronic disease as part of our 12-week Get Well program. Today we are going to talk about increased gut permeability, or what we call leaky guts, what causes that, and what can we do to improve. So what is leaky guts? Leaky gut is increased membrane permeability in the guts that can be acute or chronic. And when it happens acutely, for example, during some bacterial infection or toxic exposure, that could be actually adaptive. It means that it helps your body to recover from and get rid of that toxin or get rid of that bacteria or virus. And it's partially what helps you to increase the water inside of gastrointestinal lumen and then mechanically remove some of that toxic load and bacterial load. However, if that happens more or less chronically, then it can become more pathological. And you can see it on the left side of a picture. The cells of the guts, they are very tight between each other, and they have, in fact, tight junctions. And those tight junctions, that's what prevents molecules that are not fully digested from passing from gastrointestinal lumen into the bloodstream. However, if you have something that destroys those tight junctions, or the tight junctions becomes less tight, then those molecules that are larger than usually will be absorbed will start getting inside of the body. And there is what we call mimicry, which means that those subdigested molecules, they look a lot like parts of our tissue. And it could be our joints or thyroid or even brain. And as a result, your body starts attacking the molecules that obviously do not belong in there. But just in case, it may start attacking the thyroid or joints, and thus it creates autoimmunity. But in general, it creates inflammation and can be a cause of chronic conditions. There are research studies showing association with some autoimmune conditions like type 1 diabetes, with chronic kidney disease and fibrosis, association with IBS, which is irritable bowel syndrome. Fair amount of patients with IBS have intestinal membrane permeability, and among those, there is much higher pain score compared to patients who do not have impaired membrane permeability. There is a strong connection between leaky guts and Alzheimer and Parkinson's. So in a sense, leaky guts leads to leaky brain, and that is very important. And in general, cohort of sick people have much more leaky guts compared to cohort of healthy people. What causes the leaky guts? We did talk about effect of different bacteria with cover of bacteria created with lipopolysaccharides can affect the gut's permeability, plus foods that create allergic reaction or have intolerances, and that can create the leaky guts. Different foods, for example, gluten, even in patients who do not have celiac disease or they don't have non-celiac sensitivity, there will be still leaky gut or increased intestinal permeability for several hours after digestion of gluten. It is resolvable and it gets better. It heals itself. However, in some subpopulation, it does not, and it creates a more consistent pulse in a sense. Processed food is another cause of leaky guts, and GMO foods that have glyphosates, which come from pesticides, herbicides such as Roundup, and they can create interruption in gut barrier. Glyphosate specifically causes a lot of symptoms or deficiencies similar to celiac disease. Deficiency in iron, cobalt, molybdenum, copper, and other rare metals, because glyphosates actually chelates, or people say chelate, those elements. And as well, it causes deficiency in amino acids such as tryptophan, tyrosine, methionine, selenomethionine. And those are very similar depletions that are seen in celiac disease. So occasionally you might ask yourself, is it truly celiac disease or is it glyphosate sensitivity? What other stresses that cause GI distress? So high stress causes your body to go from parasympathetic tone into sympathetic. And parasympathetic, which is vagus is the main nerve, it designed to sit and rest and distress, sit and rest and digest technically. And sympathetic system is your fight and flight system. So if your body is constantly in fight and flight situation, then it's less likely to sit and help you to digest the food. So psychological stress causes distress in your gastrointestinal system. Circadian rhythm disruption. So if you work third shift, for example, or if worse, you work one day third shift, then second day second, and then you change for first shift, and then you have day off, then your circadian rhythm is completely messed up, and that makes you, puts you into sympathetic tone, and therefore your gastrointestinal tract will suffer. Sleep deprivation. Sleep deprivation is one of major root causes of any chronic diseases, including gastrointestinal. Again, relates to sympathetic and parasympathetic systems and production or not production of melatonin, and so on and so forth. Melatonin actually is version of the hormone and produced by pineal app in the middle of brain. It does have healing effect in the guts and helps your sphincters between esophagus and stomach to close better. Therefore, if you don't have enough of that, it can disrupt the motility of your gastrointestinal system. Environmental extremes. And it's not if you live on high altitude, but if you are visiting high altitude, that's one where your body will be under stress. Or if you live in a warm climate and you are visiting cold climate or opposite, that will be additional GI distress. Toxins and pollutants will affect the gastrointestinal permeability through different mechanisms, chemotherapy and radiation, and different physical activities. Physical activities are super important for our health. However, if they are done in the wrong time for a wrong person, it may not be good. It can create more stress, and as a result of that, will affect your gastrointestinal permeability. Different pathogens affected, and we did mention about bacterial infection, and if it's acute viral or bacterial infection and lipopolysaccharide and the toxin release, that causes the temporarily impaired gut permeability, but that's normal. However, if you have wrong bacteria, and those wrong bacteria, like in case of dysbacteriosis, live there for a long time, they create a microfilm or biofilm. They create biofilm, and that biofilm prevents good absorption, and that dysbiosis creates leaky guts as well. Small intestinal bacterial overgrowth is when the wrong bacteria lives not in a colon, but more in small intestine, as it implied by the name, and that can be a separate, and we will have a separate lecture on small intestinal overgrowth. Parasites, you'll be surprised how many people have parasites, and they could be from drinking water or eating uncooked meals or uncooked foods, meats, and so on. It's frequently we think of that as something happening in third world. However, it can occur in the United States too. And some of parasites actually, some exposure to parasites may be actually good for autoimmunity. There is some research showing that completely sterile conditions without parasites or bacteria can create more autoimmunity, and fungal infection can create thrush in the mouth or can cause yeast infection or yeast overgrowth, some in sinuses, in stomach and small intestine, as well as colon. So fungal infection can create a lot of disruption in gastrointestinal health.